Hello, I'm Dr. Joana Faria, one of the obstetric consultant anaesthetists here at Leeds.
Hello, I'm Dr. Ella Bilson, a senior anaesthetic trainee.
And we are here to offer you guided information and recommendations for your care. But first, who are obstetric anaesthetists? Obstetric anaesthetists are medical doctors specialized in providing anesthesia and pain relief, with specific training and knowledge about all the changes your body goes through during pregnancy. This includes before your baby is born, during labor and delivery, and postpartum, which is after your baby is born. We work closely with obstetricians, midwives, and other healthcare professionals to make sure you receive the most appropriate care for your needs.
During labour and delivery, an anaesthetist may provide pain relief through a range of techniques, such as an epidural or a spinal block, which numbs specific parts of the body. This is known as regional anaesthesia and is considered the safest type of anaesthesia for you and your baby. And this is usually what we would recommend to all women.
So overall, our role as obstetric anaesthetists is to ensure the safety and comfort of you and your baby when you are giving birth, and we work together with the rest of the medical team to provide this.
So, why do we want you to receive this specific information? If you are pregnant and have obesity, we will plan the delivery of your baby in more detail. This is because complications are more likely to happen for both mother and the baby. Your BMI, which stands for Body Mass Index, is calculated by your midwife at your first appointment using your height and weight. As it goes up, particularly if it's above 40, the chances of you having certain pregnancy-related complications increase.
We are very aware that many births will be uncomplicated and need no intervention. However, it is important that plans are made to ensure you and your baby remain safe should unanticipated emergencies arise. The following anaesthetic information will hopefully be helpful to you in making decisions regarding your antenatal care, including pain relief options and understanding specific challenges and recommendations.
When you are in labour, there are 3 possible outcomes for the birth of your baby: vaginal delivery, assisted vaginal delivery using specialised instruments such as Von II suction cup or forceps, or an unplanned caesarean section. There are a number of different options for pain relief when you are in labour, and these can be with or without the use of medication, from TENS, water birth and other therapies, to gas and air, opioids and epidurals. Try not to just Google search these, as there is a lot of misleading information on the internet. We recommend using trusted sources backed up with medical evidence and research. The most appropriate site to visit is www.labourpains.org.
There is a well-known association with obesity and increased risk of difficulties in labour. For this reason, the national guidance is to site an epidural early in your labour, so this can be tested and used for all unanticipated problems. The reason for citing this early in your labour is twofold. Firstly, placing an epidural catheter can be challenging in everyone and can take a bit longer to establish. Therefore, if we do this before strong contraction pain starts, the success rate is increased and is inherently safer. Secondly, and more importantly, if your baby needs an assisted or surgical delivery and we know the epidural is working well, this can be easily converted to epidural anaesthesia, meaning stronger pain relief, which reduces the risk and harm of other forms of anaesthetic to both you and your baby.
There are other advantages of a labour epidural. It is the only option that can give complete relief and accommodate the changes of labour pain. It makes vaginal examinations more comfortable. It substantially reduces your body's stress response. It means you can be more alert and less nauseous during labour. It reduces blood loss at surgery, and it reduces the risk of blood clots in the veins of your legs, known as a DVT.
Historically, there are a lot of scare stories surrounding epidurals. However, nowadays epidurals are safe, widely performed and well tolerated. But like any other procedure, they can have some potential side effects and complications. Explaining risk can be a challenge. Our information leaflet about risks of regional and general anaesthesia that will be given to you is designed in a simple way to offer clarity, so that you can understand how likely or unlikely something is to occur. It is an opportunity to find out more about what to expect and helps to explain the risks.
1 in 3 women will experience itching, 1 in 20 might need further intervention to optimise the epidural, and occasionally we will need to treat you for a drop in blood pressure once the epidural is in place. Although it varies from unit to unit, 1 in every 100 women can have a severe headache that needs to be followed up by an anaesthetist. Here you can see how unlikely more serious complications are to occur.
One of the reasons why we recommend an early epidural is to avoid you needing general anaesthetic in an emergency where you are sent to sleep and your breathing is done for you. This is because, compared to regional anaesthesia, general anaesthesia is associated with increased maternal risks, and this increases further for people with obesity in general.
Other disadvantages related with general anaesthesia that our women tell us include the fact that the birth partner can't be present for the birth, feeling more sleepy and groggy with poorer initial mum-to-baby bonding, worse pain relief post-operatively, more nausea and vomiting, and additionally it's associated with more bleeding, more post-operative breathing problems, and baby gets exposed to anaesthesia too.
What if you are scheduled for an elective cesarean section? In that scenario, the safest and calmest mode of anaesthesia in an elective cesarean section is to do a spinal anaesthetic, which, although still involves a needle in your lower back, is often faster and easier than an epidural. However, the limited time of the spinal block can be a challenge when extra time for positioning you for the procedure and extra time for surgery are expected.
If this is the case, then a combined spinal on top of an epidural is recommended. This combines the dense and quick block of the spinal anaesthesia with the flexibility to extend time of the block with the epidural catheter if needed, maintaining you awake throughout the procedure.
Finally, we want you to remember that for any procedure that is required during your pregnancy, you are in safe hands. Medical staff are highly trained and know what to do even when the unexpected happens. We will routinely visit you when you arrive on delivery suite. However, it is very important that you are informed and are given all relevant resources to know your options and our recommendations, with time to process this information in relaxing surroundings and be able to make informed decisions about the birth of your baby. Thank you for watching this video. If you feel you have any unanswered questions or want to talk to an anaesthetist prior to arriving on delivery suite, please ask your midwife to contact our department.